It is time to take a stand.
Show your hand.
We've been talking for too long.
Show your hand.
All around the Caribbean Sea.
Show your hand.
Getting to 90.
Show your hand.
Do you dare lose the fear? If you
Hello and welcome to this episode of Coalition Corner, an opportunity for us as stakeholders in the HIV response in the region to engage in candid conversation about the issues that matter to those of us who are working in the response across the region. Today we'll be talking about community partnerships and how we can build them and how those partnerships can be leveraged to ensure that we have the most impactful HIV responses. We have with us today three eminent community advocates, you call yourselves.
Advocate.
We have Marlon Tomlinson, he's a program manager at ASHE here in Jamaica. We have Mr. Patrick Lalo. Patrick is the policy and advocacy officer at Jamaica AIDS Support for Life. And we have Jamoki Patrick, who is the executive director of the Jamaica Network of Seropositives. Welcome, gentlemen.
Thank you.
Thank you. So as you know, one of the things for us is that in the HIV response is the value of foot soldiers on the ground. It's very important, and we know that the community and civil society provide those foot soldiers. We want to talk a little bit about how we can strengthen partnership across civil society organizations and what civil society organizations can bring to the table to support governments as we try to scale up HIV response. And I want to begin with you, Marlon. So can you give us a take on just how ASHE sees its role as a civil society actor in the response?
All right, so as ASHE, we're unique in the sense that we offer edutainment, and which is is an unorthodox method, is an unorthodox technique. And the reason being is we use that method is because our base and our foundation and grounding is in the performing arts. And so why not use what you are strong in to do the job, to support the job that you're supposed to do as it relates to the response. So as it relates to edutainment, a lot of the times when you're giving out information, people don't want to sit around a table and hear the information. But if you find an interesting way of delivering the message, then you can attract people. And we have what we call the EIC methodology: excite, involve, and commit. So I believe that as it relates to the community and soldiers in the community and us partnering with other CSOs, we see ourselves as the centerpiece, because I believe that we bring something to the table that everybody can benefit from as it relates to reaching the community.
Patrick, I know that the Jamaica AIDS Support for Life actually at the moment hosts the Civil Society Forum. Can you tell us a little bit about that forum and the value of that forum to the HIV response?
Let me start by saying the Jamaica AIDS Support for Life, we are the oldest HIV-focused human rights organization in the region and a very significant contributor to the response. Presently, we act as co-chair for the Joint Civil Society Forum, which is a consortium of NGOs and civil society organizations working in the field of HIV. And basically, all of these organizations, which includes ASHE and JN+, who are at the table now, are organizations that contribute to the response in different ways and from different angles. So, as Marlon spoke, ASHE does the edutainment. JASL has a strong peer program where our main focus is treatment, care and support, and also in enabling environment and human rights. And then there's JN+. And the forum comprises of other entities that focus on young girls who are affected and infected by HIV, entities that focuses on positive women living with HIV. And basically what the forum does is that all these entities addressing different groups that are infected and affected by HIV come together from time to time to see how we can support each other in the response and how we support the national response. The fact is, a major percentage of the national targets as it relates to what we hope to achieve in the response is contributed to by these civil society organizations.
I'm going to ask you to hold that thought because we're going to come back to it because it's a very important piece. But I want to throw it out to Jamoke. Jamoke, I know you represent a constituency that's a significant constituency in the HIV response. And I want to talk a little bit about how Jane Plus sees itself particularly as a leader in the JEPA principle.
All right, so thank you for having me representing Jane Plus here today. So just a little bit of background information. Jane Plus is a network of people living with HIV led by a board of directors, which are people living with HIV, and most of our initiatives and programs are advocacy based and also capacity building. Now, by just the nature of who we are a community-led organization, a community of people living with HIV. Where we are today now, we have close to 1,000 members, registered members of Jane Plus. Now, it is very important to have an organization as Jane Plus, a part of the national HIV response and a part of any HIV conversation, whether it has to do with an enabling environment, prevention, treatment, care, and support. And what you do when you have a member of the community, a part of those platforms or initiative, is to have first-hand information as to what is happening on the ground, what is happening at the health center, what is happening in communities, etc. Because it is very important to know so how we can know what to implement, what to do, where to say, how we can advocate and lobby. We're very much a part of this civil society conversation, the civil society mix, as Patrick talked about earlier. And we are very much, where it's concerned, JEPA, greater involvement of people living with HIV, that in every platform, at every stage, wherever the conversation is happening, it is very crucial and important to have somebody living with HIV present, because nothing for us without us, which means you can't be implementing HIV program, talking about HIV, without having someone living with HIV sitting at the table.
So I like that. Guys, I've been in this response for quite a while, and one of the conversations that you often hear is that we don't have a very strong civil society, a very strong community response. How would you respond to that narrative, given your own experience in the field, and what might we need to do to convince those who are elsewhere in the response that we are as strong as we should be? Marna?
Well, as Patrick said earlier, is that the JASL and civil society organizations are 100% responsible for some of the persons who are in care. Some of the persons, like Jamoke just said, JN Plus have almost 1,000 registered persons. So that means that civil society can be absent if that is something that he can report, you know what I mean?
But the argument is that you're in Kingston, you're in Montego Bay, but you're not in all of the rural, little nitty-gritty parts of Jamaica. How can we build out community responses in those parts of Jamaica where it matters most and where the evidence is showing us that stigma and discrimination is perhaps strongest?
Well, if you're talking about a civil society response, we have to look at the fact that civil society organizations are spread across the country. JASL, for one, covers island-wide. All 14 parishes are divided among our regional offices. We have peer educators based in every parish, and we specifically employ peer educators from the communities we serve and from the parishes in order to engage their peers from that parish. So the civil society response, I would totally disagree that it's weak. It's a very strong response. If you look at, for example, the cascade and what we hope to achieve in HIV in terms of the amount of people who have been diagnosed, retained in care, what the civil society organizations contribute to that overall cascade is very significant and actually makes the national cascade look better than if it was just a government response. Because the fact is, we cater for populations that have serious challenges accessing healthcare in the public sector, and it is because of how we tailor our services, how we focus on reducing stigma and discrimination, that these populations can actually feel comfortably in accessing at our sites.
So Jamoke, I wanted to build on that point and to talk a little bit about how Jane Plus is actually working in the community and across the country to achieve some of what Patrick has pointed out.
But before I get into that, I want to add to Patrick's point about how strong civil society is, because we have to remember that we are the ones that are holding the government accountable in terms of a national HIV response and where we need to go and what we need to go. We're the ones telling them, in fact, showing them that, hey, this needs to be done, that needs to be done. We're the ones that are on the ground more than any of the healthcare facilities or healthcare workers or anybody else. Right, so Jane Plus is broken up into regions, so northeast, southeast, southern, and western. And because we have an elected board of directors, there must be a representative from each of the regions. Somebody living with HIV sits on the board of directors. They are charged with the responsibility of going back to their region, of how many parish that may be, to implement the programs, to carry out the initiatives based on the resources we have as an NGO and based on their capacity. Now, it is very important to know that as an organization, we ensure that all our programs and initiatives are spread out across the country. So if we're going to do something in Kingston and St. Andrew, one has to happen in central Jamaica, one has to happen in western Jamaica. That's how we do all our programs, to even know to have a balance so that everybody can be a part of what we're doing. So that's what we have been doing. Yes, there are challenges in terms of reaching people living with HIV, because we know there are close to 30,000 people living with HIV and we only have 1,000 members. So clearly we need to do more. Even if somebody is living with HIV and they are not in need of anything or any type of support, but how can they contribute to the organization?
So I would ask the question though, Jamoke, given that Jane Plus is the civil society entity that is bringing together people living with HIV, and those concerns that you have raised about how they're interacting with the health system, what accounts for them not being
the very fear of stigma and discrimination and having to disclose your HIV status is a big thing for a lot of people who are HIV positive and don't want anybody to know. Even within their own families, nobody knows that they're HIV positive. So we have to keep that in the back of our head. Despite there are 30,000, it doesn't mean that we're going to reach all 30,000. If we go back to Patrick's point about the treatment cascade, we have close to 28,000 people who have tested positive and know their status, but under 10,000 is virally suppressed or is accessing treatment. So clearly there's a challenge where that is concerned. So if we have that where treatment is concerned, can you imagine just having somebody disclosing their HIV status to you or having a conversation with such a person? So we are mindful of stigma and discrimination. We are mindful of the environment that we're in, and people are not necessarily willing to disclose that they're HIV positive.
So Marlon, how can we improve on that? Because the issue of stigma and discrimination and the role of civil society in addressing stigma and discrimination, I hear a couple of things. That it's important for civil society to be advocates, to provide some sort of push to the government. How can civil society collaborate much more constructively and to expand even the reach of those of us who are actually doing work together to ensure that we are having that type of impact?
All right, so Ashe, Jassel, and Children First have a thing that we call the Trinity, where we work together because we understand that we're in the response together. So a lot of the times, because I'm a CSO, they're a CSO, and we have to reach a certain amount of people during the amount of time because we get funding for doing that, we treat it as a competition. But if we're able to develop trust among each other, so if all the CSOs come together and know that, okay, so we're in the field together, we're in the response together, it's not you against me, me against you, but we can work together, I think that we can accomplish more. Because stigma and discrimination is a real thing, and a lot of the times when I interact with the people, because as you say, we are soldiers in the field, that those are some of the things that they complain about, and it's our responsibility as advocates to say, all right, so this is not the way, there are better ways, there are better avenues. So Ashe do provide all the services because we're in the field of prevention. So we do like skills building sessions, we do interventions, things like that to get the information out. But at some point in time, we have to refer our client to somebody else who can provide another service that they also need. So if we all come together, because everybody brings something different to the table. What Ashe brings to the table, Jane Plus don't bring to the table, etc.
So Patrick, let's talk a little bit about that, because this whole idea about building community partnerships seems to be what I'm hearing coming out of Marlon. But is there any strategy to sit down and document what that type of partnership structure could look like. And so I know the forum is there, but is there any way else that we're looking at building that partnership to ensure that the competition doesn't occur? We are referring people, we're not losing people who would otherwise have access to the system. Is there any strategy that you can share with us?
Well, one of the things that I could speak of that is already in place, as a civil society forum, we have a plan. The plan involves, it's an advocacy plan, but it also entails what we are doing now and what we intend to do in order to strengthen the response. So in the plan, all the civil society organizations that are a part of the forum, based on their strengths and the services they offer, are assigned certain areas. And what we have realized is that the strategy is to identify the strength of each civil society partner, and instead of us duplicating our efforts, we assign to each entity what they are strong at. Also, a part of the plan is strengthening the relationship with the government, because the fact is, as civil society, we cannot take over the response on our own. It is still a national response, and the involvement of the government is still there. For example, JASL is the only CSO that offers treatment sites outside of government. So of the 38 treatment sites in the island, we run 3, the government runs the other 35. Or 3 treatment sites can absorb less than 1,000 of the number of persons in care. So the fact is, the whole host of them still have to go to the government side. So we build partnerships with the government. Every week, every month, just as in another parish, having a training with healthcare workers. There are other civil society organizations that does it as well, because it's not about making sure that our sites are friendly to all persons and that stigma and discrimination does not exist there, but we have to help the government to get their sites up to that standard. So it's a partnership between civil society and government.
From your perspective, what might be some challenges that civil society face, and how we can actually address those challenges to make sure that we are as effective as we could be? So I want to start with you, Patrick.
Civil society doing their work, funding is always a major challenge, and it's always looking to get more people, in particular the private sector, on board where it comes to funding, because in the response in Jamaica...
Can I ask a question though, Patrick? Because there are some people who are saying that, are you doing the best with the money that you're getting?
Well, I would say that the best is being done with the money that we are getting so far. The fact is, what really needs to be done, the money that we have is just not enough to do it. And the funding of HIV in Jamaica there's very little or no, officially no private sector funding, really. Most of it is from international donors and that comes through the government. So I think finances is another challenge. Coordination is also another challenge. I think the efforts can be better coordinated among the civil society partners, and I think roping in the private sector more for them to understand. For example, workspaces. HIV is a workplace issue. We have a national HIV workplace policy. We have an occupational safety and health bill that is soon to become legislation. So I think we are not as strong in getting the rest of the society to understand that this is not our issue and you over there. So this is everybody's issue.
So I'm going to throw it out to both Marlon and Jamoki. How do we get the rest of the society to partner with civil society?
Well, you see, the truth is, the topic of HIV, I don't want to call it an issue really, but it's bigger than partnership. It's bigger than our organization, your organization. It's bigger than that. Because if I look at it, it's all about behavior change, and that's how we do the skills building thing and empowerment, which is what we push. And that don't happen overnight. It's not a one-time thing or a two-time thing. It's not a me alone thing or us thing is a lifelong thing. So when Patrick was talking about the funding, yes, it is a limitation because of the investment that is involved. Is almost like you can't come in this field and just doing it because you want to do it. You have to really be interested in it and really, because you're impacting lives, you know. Because like with the 1990 thing, like we want to reach a place where people are virally suppressed, we have 0 to none new infections and stuff like that. And that funding play a huge part, but it's a long-term thing. So with all the limitations that we have to face, and then people saying civil society over here, so it's way bigger than that. The issue is way bigger than that. And like I like this conversation about us partnering and each organization contributing to their strengths and to whatever weaknesses so that we can all come together. So we can reach a place where the conversation is not about limitations anymore, but it's about moving to the next level and continue to move to the other level so that we can reach at a very, very place where we can say, okay, yes, Jamaica is doing work in this area and Jamaica is strong at it, and that the world can learn from what we are doing, just like with other things.
Jamoke, the issue around strengthening, are there particular elements of how civil society does its work that would need to be strengthened? I'm thinking about things like governance, things like just how we mobilize and engage people. How do we bring, key players to understand our issues? Are we doing a good job of those things?
I think we have started to improve on some of those things. But in general, I do believe that the people on the whole believe that NGOs should still operate like a grassroots-led organization without governance system and structure and any guiding documents or platform for the organization. But the truth is we are required to do so much in terms of providing proof of who we are as an organization or any organization in general. So we have to live up to those expectations. We have to do more if we want to be recognized as key players and true players in the response. And that's what most of us have been doing. The other thing is we have seen where over years different initiatives have come in place in the country and in the Caribbean, where that's through the US government or a global fund where they have set up different programs, etc. And within those programs, we have failed to sustain NGOs who are going to live beyond those programs when they have gone.
You mean sustainability conversation?
Right. So for example, Jane Plus is yet to have a home, and I don't believe there has been any serious conversation about that. If we're talking about HIV and people living with HIV, and especially for an organization led by people living with HIV, how are we sustaining such an organization to continue even when there is no more funding? How are they going to sustain and be more effective in their work so that they can continue their work without depending on
I
CVC?
challenge you though, because Ashe and Jas will say to you, but we didn't wait on anybody to do that.
And that's true. And that's the part of it as well, where you find that because Ashe and Jas may not have the opportunity to expand depending on their resources and how effective their leadership is, you have some other NGO may not have had that and are now at that stage where they are building on that or trying that. So, but the truth is, led by people living with HIV, for people living with HIV, that does work for people living with HIV, our focus should be on sustaining and helping those organizations as well in the response, because I want to know that anybody living with HIV that I have somewhere with people who are similar that I can share my views with and who are looking out for me.
So my final question as we seek to wrap up is, are there any lessons that we can share with our colleagues in the Caribbean from our own Jamaican experience?
I do believe that we have a strong civil society presence in Jamaica. I mean, yes, we do different work, but when we need to come together, we do that. And when we need to meet with and have the conversation, we do that. When we need to talk up to the government or anybody about HIV, we do that. So that is one thing I believe that can be replicated across the Caribbean. Just to formalize that mechanism to ensure that as civil society organization, whether it's community-led or otherwise, that you're meeting and you're having the conversation with each other.
You see, when we decided to partner with Jocelyn and Children First, we realized that the work got a little easier because we didn't feel like lost soldiers in the field doing the work by ourselves. But if we ever needed anything, we could always call on somebody. And that is something that anywhere in the world you can capitalize on and also replicate. Partnership, working together, because we're all in the response together.
So, Patrick, for you, what's next for the Civil Society Forum as a mechanism for building that partnership?
So from here on, we are continuing dialogue with the national response, with the Ministry of Health, to seek to strengthen the partnerships. And we have some advocacy initiatives that are a part of our plan that we'll be rolling out from here going on, that are all geared at civil society government partnership strengthening and meaningful engagement of the people who are affected in the process.
Good. So I want to thank you very much, gentlemen. I think you have brought some perspectives to the discussion that I think we'd want to share with our viewers. There are certainly a significant number of strengths that you have identified. I note also that there are some challenges, and it was useful that you provided us with some way forward to how we might address some of those challenges. To your viewers, I want to say thank you, and I look forward to seeing you again next time on Coalition
It is
Talk.
time to take a stand.
Show your hand,
We've been talking for too long.
show your hand.
All around